Hey everyone, it's Austin Chang. I just figured I'd jump on here and talk about this past week and a half, which has been a little rough, not gonna lie. Just been a series of different events, some highs and lows, and a whole roller coaster of emotions. And not to complain about my job or my life, because I consider myself to be a very fortunate person, but it's just been one of those weeks, and I'm sure many of you have had weeks like this. And it started out with an on-call weekend and being called into the hospital for a procedure, which I'll get into in a little bit. That was originally the video that I was planning to upload whenever this was going to go up previously. Hey everyone, it's Austin Chang. I am being called in for an emergency procedure right now. And a series of events that followed the following week really prevented me from doing that. But then after that, I also got Lasik Eye Surgery done. So that explains this, which I'll get into as well. It shouldn't always look like this, but this is really what happened. A little bit unexpected. And also, I was nominated for a GLAAD Media Award, which was totally awesome. A super high among many different lows. And finally, I lost my grandmother this past week, and I felt that as a tribute to her, I would talk a little bit about that. So like I said, it started out with an on-call weekend, and the purpose of that video was to talk about me as an attending physician in my subspecialty, what an on-call weekend looks like. And my job as the attending on call is to decide whether or not something is urgent enough that we have to go in overnight, or if it can wait a couple hours until the next day, or a couple days after that. Who knows? Or whether or not we even have to go in at all. And so I'm a gastroenterologist, and my subspecialty is advanced endoscopy. And even within my own field, the emergencies that I deal with are different from those dealt with by my general gastroenterology colleagues. So the general gastroenterology emergencies that they often deal with are GI bleeding in the gut, or food impactions, like food getting stuck in the esophagus, people who swallow foreign objects or sharp objects like razor blades, they have to go in and take those out. But some other emergencies call on specific procedural expertise that I have, like bile duct infections or cholangitis, or perforations after people have had surgery, if a hole was caused, or bile leaks, things like that. And another thing I wanted to highlight from that video is that our specialty has different sets of emergencies from other specialties, right? And the urgency also tends to be different. This is not like a code blue situation where we have to run to a bedside and do CPR. This is also not the type of emergency like what the cardiologists have to deal with. If someone's having a myocardial infarction and there's a blockage of a coronary artery, they have to go in right away to open up that artery. Otherwise, that heart muscle is lost forever and the patient might die right there. And it gives us more time to coordinate our staff in the safest way possible. With that understanding, our colleagues also will prioritize. We rely on our anesthesia colleagues. If they have other emergencies happening, our cases may get delayed. And the urgency is a little bit different. Sometimes it's better that we wait and stabilize the patient before taking them for a procedure. But then once everything is figured out, we have to communicate with our nursing staff, with our endoscopy technicians to bring everyone together to get this procedure done. Fortunately, a lot of the logistics is dealt with by my advanced endoscopy fellow, but nonetheless, a lot of the responsibility falls on me. Part of what I was documenting in the footage was the fact that there had been some anti-Asian hate crimes around the country at that time. Also, even race aside, some doctors who were attacked around our hospital recently, and me just being aware of how do I get to the hospital safely and how do I get home safely. The case started at midnight. We were there until 4 a.m, and I had to kind of figure it out. I actually had to call in the troops the next day for a Saturday afternoon case as well. It's not always that we have this many cases over the weekend, but that was really what that weekend was about. And fortunately, the overnight case happened on a Friday night into a Saturday, because for those of you who've been on call, I'm sure you can all probably relate how an overnight case can really throw off your sleep schedule. And if that were to happen during a weekday, I would have to show up the next day to do procedures or see patients, because we as doctors aren't as able to just call out sick, because if we call out sick, then everything has to get rescheduled, unfortunately. What's also different with us being on call as advanced endoscopists is that we take call a little more frequently, because there are a lot more general gastroenterologists, and there are a lot fewer of us to split the call for advanced endoscopy procedures. So that was how this whole week started. I was then scheduled for Lasik eye surgery, and part of the reason why I decided to do that was because I have to wear heavy lead glasses to prevent radiation exposure, which honestly I have not been doing regularly because A, they're uncomfortable to begin with, and B, because I had a prescription, a strong prescription, they're super heavy and just wouldn't stay on my face. And in order to prevent any further radiation injury to my eye, I felt like, you know what, it's probably time to get LASIK. And for those of you who wear glasses, I'm sure you also understand the troubles with buying sunglasses or swimming or, things like that, even though there are ways to work around it, like prescription goggles, it's just not the same. But of course, I did not expect this to happen. It should have looked something like this at this stage, but this eye ended up looking like that because there was a little bit of extra work done here. Apparently, what I was told is to get my eyeball in position, I didn't realize that I have something called correctopia, or an off-center pupil, and that affected their ability to get my eyeball in position to do the LASIK laser eye surgery. And I'm not an ophthalmologist, so I don't know any more detail than that, but hopefully this will heal in a couple weeks. I've watched several time-lapse videos here on YouTube just to make sure that things were on track and things are improving. It's not painful, and I continue to do the different drops that I was prescribed, and hopefully just get better from here. And while that was unexpected and kind of threw me for a loop, what was expected was that I was nominated for a GLAAD TikTok Media Award for TikTok LGBTQ Advocate of the Year, which I had known about for a little bit, but the award ceremony happened this past week as well. And Jojo Siwa presented that category and said my name, which was really cool.
TikTok asked you to vote for your favorite. Here are the nominees. Dr. Austin Chiang.
So I was just glad to be nominated. I didn't end up winning. And the person who won, Josh Helfgott, is totally amazing. So I'm super happy that he won. And to be honest with you, I always felt like I wasn't deserving of the nomination, but I have talked about some LGBTQ related health issues on my social media channels and have collaborated with the Trevor Project, whose cause I believe 100% in when it comes to their crisis prevention services. But it was really cool to see myself on the screen and see Demi Lovato come on the screen afterwards, and Dan Levy accept the award for Schitt's Creek. Big fan of the show, loved that moment. As cool as everything was, it was hard to really enjoy and appreciate the moment when it happened because of everything else that was going on. And finally, what weighed on me the most this past week was the passing of my grandmother. She was 97 years old and she lived a very healthy, long life. She was generally a very healthy person her entire life. And she passed peacefully as anyone could ever hope to depart from this world. And I think what makes it particularly difficult is that I haven't seen her since 2019, pre-COVID. And now it's unrealistic for me to go back to Taiwan, quarantine for 2 weeks, and take the amount of time that I should be taking away from my job to be able to send her off. And of course, as expected, an event like this will cause me to realign myself and reevaluate my priorities in life. But two lessons that I learned was that first, she outlined her wishes long ago to be DNR DNI and to be able to pass away peacefully and comfortably. And having those wishes outlined ahead of time was very helpful for our family to make the appropriate decisions. And the second thing I learned was that it's a tremendous privilege to be a doctor because I am able to help the family navigate this really complex, overwhelming amount of healthcare information. I have access to other doctors to ask questions. Outside of my specialty, I still have to ask other doctors for their advice and ask them, hey, is this the way to think about this? Am I not thinking about this correctly? I can call on other experts very easily by picking up the phone, sending them a text, sending them an email, which is exactly what I did. And also to let the doctors there know that I am a doctor as well, and I want to have a conversation and be informed at a different level of understanding. And honestly, after every time I'd see her in Taiwan, every time I went back to visit, I would, hug her and say goodbye. And in my mind, I made a mental note that that would potentially be the last time I'd ever see her, given her old age, because you just never know. There could be the unexpected that happens. And I mean, for that matter, the unexpected could happen to anyone, regardless of their age. And in fact, this past week, there have been other deaths among close friends that really it's not my story to tell, but that certainly has compounded everything that's been happening in my life. But again, we honored and respected my grandmother's wishes, so she was able to move on from this universe as peacefully and painlessly as possible, and for that I'm very grateful. Let me know also if you can relate to any of these experiences. I would love to hear your thoughts. If you've seen my videos before and want to continue to see my videos, please consider subscribing. But until the next video, as usual, please stay safe, stay healthy, and I'll see you all very, very soon. Bye!